Hello, my name is Sharetta. I'll be conducting a final head-to-toe assessment on my patient today. The first thing I'm going to do is have my camera person scan the room for cheat notes. All right, the next thing I'm going to do is check my patient's charts for the doctor's orders. And after I check my patient's chart for doctor's order, I'm going to knock on the door and introduce myself. Hello, my name is Sharetta. How are you doing today?
I'm doing good.
Okay, very good. I'm going to provide privacy for my patient, and then I'm going to wash my hands, and I have hand sanitizer here as a supplement to wash my hands. And after I wash my hands, I want to confirm 2 identifications for my patient. Can you give me your name and date of birth, please?
Shaquita Lee, 121, 1993.
All right, thank you. And what brings you in today?
Just a regular checkup.
All right, and I'll be conducting a head-to-toe physical for you on you today, if that's okay.
Okay.
All right, and before we get started, are you experiencing any pain anywhere on your body at all?
No.
Okay, very good. All right, so I'm gonna ask you a couple questions about your head. Do you have frequent headaches at all?
No.
Do you have migraines?
No.
Have you ever had any concussions?
No.
Have you had any contusions?
No.
A family history of any of these disorders at all?
No.
All right, the first thing I'm going to do is I'm going to palpate through my patient's head. And as I'm palpating through my patient's head, I don't see any signs of pediculosis at all in the head, any scrapes or any openings, ulcers, any abrasions or bumps at all in the head. Everything looks normal. Her head is normal cephalic. Her hairs are evenly distributed throughout her head. Her hair is fine, long, and clean, which is good. And now I'm going to palpate my patient's temporal pulses. And as I'm palpating my patient's temporal pulses, they are equal, strong, bilateral +2, which is good. And now I'm going to check my patient's skin temperature. Her skin temperature is warm and dry and smooth, and nothing of concerning, which is good. Her skin color is appropriate for her ethnicity. Her skin turgor is hydrated, which is good. All right, the next thing I'm going to do is check for cranial nerve number 1. Do you have any history of nosebleeds?
No.
Do you have any flu-like or common cold symptoms at the moment?
No.
Do you have a family history of nosebleeds?
No.
Have you ever had any surgery on your nose?
No.
Okay, very good. All right, I'm gonna have you close your eyes. All right, can you smell? What do you smell?
It smells like vanilla.
All right, very good. Okay, so patient is able to smell. And now what I'm going to do is have you hold one nostril and breathe in, and do the same for the other. Okay, so my patient nares are painting, which is good. And I'm going to take a look into her nose for further assessment. And as I look into the nose, there are hairs present, and they're evenly distributed throughout. I don't see any signs of perforations or deviations in the nose. The nose is pink and moist, which is good. And I don't see any cuts or anything of abnormal coming from the nose or any drainage, which is good. All right, so cranial nerve number 1 is intact. And now I'm going to check for cranial nerve number 2. Number 2, we would check for the Snelling chart. How often do you see your eye doctor?
Twice a year.
Okay, very good. Do you have any eye problems?
No, I just wear glasses.
Okay, and you don't have any type of complications with your eyes at all?
No.
Okay, very good. Okay, so cranial nerve number 2 is intact because she did the Snelling chart with her eye doctor, which is good. And I'm going to further assess her eyes. So I'm going to use the 6 cardinal gazes to test her eyes. So I'm going to have you move your eyes, not your neck, and just follow my pen. Okay, very good. So cranial nerves 3, 4, 6 are intact, and I'm going to further assess her eyes. I'm going to use Perla for this assessment. Okay. Very good. All right, And as I looked into her pupils are equal, round, reactive to light. They're direct and consensual. And now I'm going to check for accommodations. So I'm going to have you focus on this picture right here. And then when I tell you look at my pen, I want you to look at my pen. Look at my pen. Okay, very good. So patient eyes went inward, which was normal. So her accommodations are good, which is good. So her pupils are equal, round, reacts to light, direct, consensual, and accommodations. And now I'm going to further assess her eyes. So can you lift down her eyes? Okay. As I'm looking into her eyes, her cornea is clear. Her conjunctiva is pink. Her sclera is white. I don't see any signs of opacities or glaucoma in the eyes. Her lacrimal glands are normal, which is good. All right. Can you lift up your eyes? Okay, so nothing of abnormal at the top of the eyes. Her hairs on her eyelashes are evenly distributed throughout. Her hairs on her eyebrows are evenly distributed throughout. And on her face, she has a few macules, but no irregular borders at all with her macules on her face, which is good. She don't have any pustules on her face at all, so nothing of concerning there. Now I'm going to check for my patient's ears. Do you have any problems with hearing?
No.
All right. Do you have a history of ear infections?
No.
All right. Do you have a family history of ear infections?
No.
Okay. So I'm going to check into my patient's ears. And as I'm looking into the left ear, there is a little bit of serum in the ear. Her tympanic membrane is pearly gray. There are a few hairs present, but they're distributed throughout. No drainage or anything of concern coming from this ear, which is good. Now I'm going to check for her right ear. Her right ear, she has a little bit of serum in it, but nothing of concerning. She does have hairs present in her ear, but they're evenly distributed throughout. Her tympanic membrane is pearly gray. No drainage or anything of abnormal coming from her ear, which is also good. All right. And now I'm going to push, pull, and push. I want you to tell me if you feel any type of tenderness at all, okay? Mm-hmm. So push on the tragus, pull on the pinna, push on the mastoid process. Did you feel any type of pain at all?
No.
Okay, and now I'm gonna whisper, and I want you to tell me what you hear and on what side, okay?
Okay. Apples, left side. Oranges, right side.
Okay, very good. And now I'm gonna have you stand up. Close your eyes. All right, so my patient is not swaying from side to side, which is good. And I checked her hearing, so cranial nerve number 8 is intact. You can sit back down. Do you have any sinus issues at all?
No.
Do you have a family history of sinus issues?
No.
All right. I'm gonna palpate the frontal sinuses. Did you feel any tender pain at all?
No.
Okay. And the maxilla sinuses. Do you feel any tender pain at all as I do that?
No.
Okay. So everything looks good there. All right. So the next thing I'm going to do is I'm going to check for my patient's cranial nerve number 5, which is her TMJ. I'm gonna check the sensory and the motor part of it. All right. Do you have any problems with chewing at all?
No.
Swallowing?
No.
Okay. Family history of problem with chewing or swallowing?
No.
All right. I'm gonna have you move your jaw up and down, around. Okay, so I didn't hear any crackling or popping at all in her jaw as she moved her jaw up and down. So for the motor part is good. So now I'm gonna check the sensory part of her TMJ. All right, so can you close your eyes? And I want you to tell me if you feel a sharp or dull sensation, and where.
Dull left forehead. Dull right forehead. Sharp right left cheek. Sharp right cheek. Sharp left chin. Dull right chin.
Okay, so patient was able to feel all sensations in her TMJ. So cranial nerve number 5 is intact, which is good. Now I'm gonna check for cranial number 7. I'm gonna have you do a few facial expressions for me. So I want you to raise your eyebrows up. I want you to frown for me. Puff up your cheeks and smile. All right. So cranial nerve number 7 is intact. Her accessory muscles were all good. She was able to do all of the facial expressions that I asked her to do. All right. Now I'm going to check for cranial nerve number 11. Can you shrug your shoulders? Okay. Move your head around. Okay. Resist. Resist. Okay. Very good. So patient was able to do that. Have you ever had any problems with movement at all in the upper extremities at all?
No.
Okay. So cranial nerve number 11 is intact, which is good. All right, so I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Okay, so patient was able to verbalize the words that I've repeated to her. So cranial nerve number 12 is intact. Now I'm going to check for cranial nerve number 9 and number 10. When was the last time you seen the dentist?
Earlier this year.
Okay, that's good. You have an appointment with your dentist?
No, not. It just passed. It was earlier this year.
Early, so it passed already.
Yeah.
Okay, so was everything okay?
Yes.
Okay. Do you grind your teeth at all at night?
No.
Okay. Can you say "ah" for me?
Sorry, I had to yawn.
Ah. Okay. Say "ah" again. Ah. Okay. So both the soft palate and uvula both raised together. Her pharyngeal wall does not look irritated. It's pink, which is good. Her buccal mucosa is pink and moist. Her tonsils are +2, which is good. I don't see any scrapes or any abrasions or any abnormal at all in the mouth. Okay, can you stick your tongue out? Okay, can you move it? Okay, so patient's able to move her tongue, and as she stuck her tongue out, her tongue didn't sway from side to side, which is good. Okay, can you lift up your tongue so I can look underneath the tongue? Okay, so as I look underneath the tongue, there's no cuts or abrasions or anything about normal in her mouth. As I look at her teeth are all intact. She has a few cavities in her mouth, some up top, some at the bottom. Next, I'm going to check your gums. Can you lift your lips, your bottom lip down, please? All right, and as I check her gums are pink. Her inside of her bottom lip is pink. Everything is normal there. No cuts or abrasions or bleeding at all in the gums at all. Okay, so can you pull your upper lip up? Okay, so at the top part of her gums, everything is pink and moist. Nothing of abnormal at all. No abrasions or cuts. Everything looks normal there, which is good. All right, so cranial nerve number 9 and 10 are both intact. And as I look at her lips are pink. Her lips are symmetrical, which is good. Her ears, as I talked about earlier, is symmetrical to her jawline, which is good. I don't see any signs of cyanosis at all in her lips, so everything appears to be normal. So I check for cranial nerves number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. So all her cranial nerves are all intact, which is good. Now I'm going to check for her lymph nodes. Do you have any problem with thyroid problems or lymph node problems at all?
No.
All right. I'm going to start with the pre-auricular, post-auricular, in the back of the head, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, deep cervical, posterior cervical, and then can you hunch over? And then supraclavicular. All right, and as I checked all 10 lymph nodes, they were all non-palpable, and if they were palpable, they have to be smaller than a pea size and they have to be movable. So there was nothing of concern in her lymph nodes. Now I'm going to check her thyroid. Can you, before I check your thyroid, can you swallow for me? Okay, so she swallowed, it went down symmetrically. I could feel the sensation. So no weakness in her swallowing, which is good. Can you lift your head down? Okay, so I'm gonna push over the trachea. Check for the thyroid. Okay, and Everything is good with her, normal with her thyroid. I palpated. I don't see any bulging of her neck at all. I don't see any signs of infection of her neck or her thyroid big from one side or moving to the other. So everything looks normal there. The next thing I'm going to do is have my patient push, check for upper extremities, push, pull, squeeze. So patient was able to do, strength was symmetrical, everything was normal there. She was able to do that. I'm gonna check the size of my patient's muscle. Can you move your hand? Okay. And as she's flexing and extending, the size and shape of her muscles are normal. Everything appeared to be intact. I'm gonna check the other side. Size and shape of her muscles. All right. And as she extends and flex her muscles, everything appears to be normal. Everything appears to be intact, which is good. All right. The next thing I'm going to do is palpate my patient's carotid pulses. Do you have any heart problems, cardiac problems at all?
No.
Have you ever had heart surgeries at all?
No.
Have you have a family history of cardiac issues at all?
No.
Do you have a certain diet that you follow by
No.
that pertains to your cardiac?
No.
Okay. All right. I'm going to palpate my patient's cardiac pulses, carotid pulses, not cardiac, but carotid pulses, and I will do that one at a time because if I do it at the same time, it could cause syncope into the patient. So as I'm checking, very good and strong. All right, very good and strong. So my patient pulses are strong, equal bilateral +2, which is good. And now I'm going to check down 3 areas of my patient's neck for the carotid pulses with the bell, 2 places at a time. So I'm going to have you take a deep breath in, out, take a deep breath in again, out, hold it. All right, exhale. Take a deep breath in again. Out. Hold it. All right. Release. Take a deep breath in again. Out. Hold it. All right, very good. There were no bruises noted as I listened to the carotid pulse, which is good. All right, so I'm asking you a few questions about your respiratory system as well. Do you have a history of asthma?
No.
And any history of pulmonary embolism or any problems with your lungs at all?
No.
Lung collapse at all?
No.
Surgeries at all to your lungs?
No.
What about a family history of respiratory issues?
No.
Okay, very good. All right, and as I'm looking at my patient's accessory muscles, she doesn't appear to be in shortness of breath or in respiratory distress at all. Her lips are still pink and moist, no signs of cyanosis at all on her lips, which is good. All right, so the next thing I'm going to do is I'm going to inspect my patient's anterior chest wall. And as I inspect my patient's anterior chest wall, she does have a few macules again on her anterior chest wall, but nothing of concerning, no irregular borders at all with the macules. There's no signs of pustules or bumps or at all, or any of abnormalities at all on her chest, her anterior chest wall. And now what I'm going to do is I'm going to palpate through her anterior chest wall. Lift up your shirt a little bit. And I will palpate from the apices of the lungs all the way down to the 6th intercostal space. Okay. Mm-hmm. All right. So as I palpated, there were no bumps at all, or lumps, or any tumors, or any anything of abnormal that I felt when I palpated. I didn't feel any crepitus at all, or crackling, popping in the skin, or hear any crackling, popping in the skin when I palpated, which is good. So now what I'm going to do is I'm going to percuss from the apices of the lungs all the way down to the 6th intercostal space. All right. So I'm gonna have you take a deep breath in and out, in again and out. Hold it. All right, release. All right, come on this side. Take a deep breath in and out. In again. Hold it. Okay. Release. Good. And as I percussed through the anterior chest wall, there were no timpani sounds or dullness sounds, which is good. The anterior chest wall when I percussed was resonant. I didn't hear any crackling or popping at all as I percussed through the anterior chest wall. Now what I'm going to do is I'm going to auscultate through the anterior chest wall. And as I said earlier, from the apices of the lungs all the way down to the 6th intercostal space. And I'm going to use my diaphragm. Hold everywhere that I touch you. I want you to take deep breaths in and out, okay? All right. All right, very good. And as I auscultated on the anterior chest wall, her lung field was resonant. There were no wheezing or stridor sounds or bronchi sounds at all, or any adventitious sounds. So the whole anterior chest wall over the lung field were resonant, which is good. All right, so now I'm going to check for tactile fremitus in her anterior chest wall while I'm already here. So I'm gonna have you say 99 all the way down. Okay.
99, 99, 99, 99, 99, 99.
Okay, so as she said 99 all the way down, the sounds diminished, which is very good. All right, so now I'm going to do it again.
99, 99, 99, 99.
Okay, which is good. Her sounds diminished again all the way down. So there were no problems or abnormalities there. And now I'm going to check for her PMI, which would be the midline and midline of the 5th intercostal space. So can you raise your arm, please? Okay. And the rhythm appears to be normal as I check for her PMI. And her as I'm expecting it, I don't see any heaves or lifts at all, which is normal. All right, your hand down. Okay, and now I'm going to check her valves of her heart by using ape to man, and I'll be using a bell as well to do this. Okay, so I'm gonna start at the sternum notch. Go down to the 2nd intercostal space, right sternum border, and listen to the aortic. All right, I'll go over across 2nd intercostal space, left sternum border, and listen to the pulmonate. All right, and I'll go down one, left sternum border, 3rd intercostal space, and listen to Erb's point. Good. And then I will go down to fifth intercostal space and listen to the tricuspid. Very strong and good. All right, and I will go over to the left sternum bottom, mid clavicular line, fifth intercostal space, and listen to the mitral valve. All right, so S1 and S2 noted were normal rhythm, strong. There were no bruits noted, no murmurs or extra heart sounds, and as earlier patient noted, she have not experienced any cardiac issues in herself or family members, which is good. All right, the next thing I'm going to do is I'm going to go to the posterior chest wall. And as I'm expecting the posterior chest wall, she does have a few macules as well on her back. Nothing of concerning, no irregular borders at all. If I did see some irregular borders, I would do A, B, C, D, E for this. I don't see any pustules or bumps or any other abnormalities on her back, so everything appears to be normal. Her skin temperature is warm and dry to touch, which is still good. Her skin color on her anterior chest wall and posterior chest wall her color is still appropriate for ethnicity on her skin, so which is good. And now I'm going to palpate through the posterior chest wall. And when I palpate through the posterior chest wall, I will palpate from C7 to T10. As I palpated through, I didn't feel any signs of crepitus or hear any crackling, popping in the skin. When I palpated through, everything appears to be normal there. And now I'm going to percuss through the posterior chest wall. So can you take a deep breath in and out? Take a deep breath in again. Hold it. All right, relax. All right, so as I percuss through the posterior chest wall on this side, I didn't feel any or hear any tympany or dullness sounds. I'm gonna now percuss on the other side. Can you take a deep breath in and out? Deep breath in and again. Hold it. All right, and as I percuss, we can relax, so sorry. And then as I percuss through the other side, there were no tympany or dullness sounds. The sounds were resonant, which is good. And now I'm going to auscultate through the posterior chest wall from C7 to T10. Okay, every time I touch you, I want you to take deep breaths in and out.
Okay.
And as I auscultated through the posterior chest wall, there were no tympany or dullness sounds. There were no rhonchi, wheezes, or stridor sounds at all. The whole posterior chest wall over the lung field was resonant, and I didn't hear any adventitious sounds, which is also good. And now I'm going to check for AP diameter. Okay, can you take a deep breath in and out? All right, and as she took a deep breath in and out, her AP diameter was 1-to-2 ratio, and both of my hands raised symmetrically, which is good. And now I'm going to check for tactile phremesis now. Okay, so I want you to say 99 all the way down.
99, 99, 99, 99, 99, 99, 99.
Okay, which is good. Okay, so her sounds diminished as it went all the way down. So everything appeared to be normal there. And I'm gonna have you do it again. Say it again.
99, 99, 99, 99.
All right. The sounds also diminished still all the way down, so everything appeared to be normal there. So as I'm looking at her posture is erect. I don't see any signs of kyphosis or scoliosis at all in her back. So everything appears to be normal. Her spine is symmetrical and the lines up midline with her back, which is good. All right. The next thing I'm going to do is check my patient's skin temperature again on her upper extremities. Skin temperature is warm and dry to touch. Skin color is still appropriate for the ethnicity. There is a few scars over here on her arms, but nothing appears to be abnormal. She doesn't have any hairs present on her arm at all. So I'm going to check for my patient's brachial pulses. And both are strong and equal, +2 bilateral, which is good. I'm going to check for her radial pulses. Radial pulses are equal, strong, bilateral, +2, which is good. I'm going to check for pededema. All right, and there's no signs of pededema at all. And I'm going to check now for capillary refill in my patient's left digitals. And I check for capillary refill is less than 3 seconds. I don't, which is good. I don't see any, her fingernails are clean. I don't see any signs of clubbing or cyanosis or discoloration in the fingertips. I don't see any nodules or bumps at all on her knuckles, or I don't see any signs of arthritis at all in her fingers. Everything appears to be normal on her hand. I'm going to check for her capillary refill in her right digitals. All right, and as I check the capillary refill in her right digitals, the capillary refill is less than 3 seconds. Her hands doesn't have any signs at all of clubbing at all or any nodules on her knuckles. Her fingernails appears to be clean, nothing of concerning, no signs of clubbing at all, as I said, or signs of arthritis at all in her right hand. So that's really good. All right, so now I'm gonna have my patient lie down. All right, so I'm gonna ask you a few questions. Do you have you experienced any nausea?
No.
Have you ever seen any blood in your urine?
No.
Blood in your stools at all?
No.
Have you ever had any abnormal pap smears?
No.
Do you see? Have you ever had any bowel problems?
No.
All right. Do you have any pregnancies at all?
No.
Have you ever had any pregnancies?
Oh yes. I'm sorry. I
No,
have
you're
two.
fine. You have 2 pregnancies?
Mm-hmm.
All right. And were both of them normal?
The first one I miscarriage, second one full term.
Okay. What happened with the first one? You said the first one miscarriage?
Yes.
Oh, I'm so sorry about that. All right. So you never had any complications at all with pregnancies?
No.
Have you ever had a history of STDs at all?
No.
Okay, very good. Have you ever had experiencing any type of frequent urination?
No.
Any burning sensation at all?
No.
Okay, very good. All right, so as I'm checking the contour of my patient's abdomen, it is flat, which is good. She does have a belly button ring. Her umbilicus is midline with her stomach. I don't see any bulging or pulsations at all coming from her abdomen. So, are you experiencing any pain right now?
No.
All right. And as I'm inspecting her stomach, I don't see any bumps at all or any pustules at all or cuts at all on her stomach, which is good. So now I'm going to auscultate from the right lower quadrant to the left lower quadrant. And I will use the diaphragm. All right, so all of her bowels are +4. They all are active in all 4 quadrants, which is good and present. And I heard a gurgly sound, which is a normal sound when you listen to the bowels. The next thing I'm going to do is I'm going to percuss through the same pattern from the right lower to the left lower quadrant. Okay. Are you experiencing any pain at the moment?
No.
Okay. All right. And as I percuss, I heard like a timpani sound, which is good over normal sounds over organ. I didn't hear any abnormal sounds. Everything appeared to be normal as I percussed through the all 4 quadrants. And now I'm going to palpate in the same pattern. I'm going to use light palpation. Tell me if you feel any type of pain or tenderness.
No.
And as I lightly palpated through all 4 quadrants, I didn't feel any bumps or tumors or any hard bumps at all or anything of abnormal when I lightly palpated through the 4 quadrants. Everything appeared to be normal, which was good. I usually would deep palpation through this through her quadrants, but for this video, we're gonna save that for my patient's comfort. All right, the next thing I'm going to do is I'm going to listen to the arteries in my patient's abdomen area, and that will be the renal artery, the iliac, and the aortic. And I would use the bell for that. And how you would do this is you would use a V where the umbilicus is at. And right here would be the aortic. This will be the renal. This will be the renal. All right, and I will do an upside down V to listen to the iliac artery. So the iliac. And the iliac. All right, and there were no bruits noted when I listened to the arteries in her abdomen area, which was good. I would usually palpate the femoral pulses, but for this video, we're not going to do that. So I'm going to go straight to the popliteal pulses. All right, and they both are equally strong, bilateral, +2. And as I'm looking at her legs, look at her legs. There are no hairs present. There are a few maculas on her legs, but nothing of concerning. There is a little bit of striae on both of her left and right thighs, but nothing of concerning. All right. Her skin temperature is still warm and dry to touch. Her skin color is still appropriate for her ethnicity. And now I'm going to listen to her posterior tibia pulses, which will be in the grooves. And they are equally strong, bilateral, +2. And I'll check for PD edema. And none noted, which is good. And then I'll check for the dorsalis pedis pulses, which should be on the top of the foot. And they are equal, strong, bilateral, +2. Now I'm going to check for capillary refill in the lower digitals. And as I check for capillary refill in her left foot, it was less than 3 seconds, which is good. Her toes, not finger, but her toes toenails appear to be clean. Nothing of concern, no nodules or any signs of arthritis or bumps at all or anything abnormal in her toes. So everything appears to be good there. Now I'm going to check for the right digitals. All right, and it was less than 3 seconds when I checked the capillary refill in her right foot. Her toenails appear to be clean, no nodules or bumps at all, or any signs of arthritis or any abnormal with her toes, no signs of cyanosis or any discoloration in either toe. So everything appears to be good there. And now I'm going to check for sensation in my patient's foot. Can you tell me if you feel a dull or sharp?
Sharp. Sharp. Dull. Sharp. Sharp. Dull.
So patient's able to feel all sensations in her feet. So now I'm going to do the Babinski reflex in both of her foot. Okay, good. Okay, so patient's foot curled in, which is good. So that's a normal reflex. So now I'm going to have you put your knees all the way to your stomach. Okay, very good. Now I'm going to have you push, pull. Okay, how you lift up your both of your legs. Okay, very good. So patient was able to do that. So I'm going to have my patient stand up. I'm going to have you stand over here. And I'm going to have you walk to the couch and back over here to where you're at. And as I'm checking my patient's gait, it appears to be normal. She's not stumbling or appear to have or need any assistance with walking. So everything appears to be normal there. Her gait is normal. Now I'm going to have you put your leg down one shin like this. Do the other one. Okay, which is good. All right, I'm going to have you do a few range of motion exercises. So can you do pronation and supination? Okay, can you do abduction and induction? Deal with both, yep. And can you do inversion and eversion? All right, very good. All right, so my patient's upper and lower extremities are all intact, so her musculoskeletal system appears to be normal, which is good. I'll have patient sit back down. Can you tell me today's date?
Today's date is 4/18/2019.
Okay, good. Can you tell me the day today?
Today's Thursday.
Okay, can you tell me the weather outside?
It's raining.
Okay, good. All right, can you tell me where you're at?
I'm in a room.
All right, and can you touch your finger on your tip of your nose? All right, and can you tell me if there was a envelope with a stamp on it, where would it go?
In the mailbox.
Okay, so patient Glasgow scale is 15. She was alert and oriented ×3. Her lock was normal. She was spontaneous and erect and able to follow command. She was able to have a logical thought process. Her speech was clear. She was able to conversate back with me on a normal basis. So I didn't find anything of abnormal. Her speech wasn't slurry. So my patient appears to be normal. She is appropriately dressed for this assessment today. She's really clean, which is good. All right. Do you do the normal breast examinations, self breast examinations?
No.
You don't normally do them? Okay,
No.
so a little advice, I advise you to do that normally, even if you come out of the shower, even if you're just lying down, just to check to detect early breast cancer. Do you know how to do that?
Yes.
Can you show me how to do that?
I would take either hand and raise it above my head, and I would take the opposite hand and feel around my areola, and I'll check for lumps or any abnormal feeling.
Okay, very good. Well, thank you. And do you have any questions for me at all, Shaquita?
No.
All right. And one more question. Are you sexually active at the moment?
Yes.
Okay. So are you using protection at all?
No.
Okay. So are you planning on having a child?
Yes.
Okay. Well, congratulations on that. And again, I'm sorry about your miscarriage. If you need any counseling resources, I can help you with that at any time. And if you have any questions about help with your next challenges of having a baby, you can always come to me. You always can follow up back with us or with the doctor's office.
Thank you.
All right. Well, thank you, and you have a wonderful day, Shaquita, and we'll see you in a year.
Okay.
All right.